meaning, just to kind of in a way to summarize the person back into the process relationship. So out of the content reporting and into the process reporting. And I might do that by saying, it seems like you're telling me the story to say this, and offer a meaning for the story. And once again, I want to be making sure that I'm not influencing them yet. That, when I'm really using these empathic skills, I want to kind of draw upon what I'm getting a sense from their frame of reference, what the meaning of this story might be, and offering that back, checking in with that. And so now when we talk about validation skills, when we're working with our patients who have Alzheimer's and dementia, we still have this kind of basic, person-centered does fit with somebody who has a lower level of cognitive capacity. So when we start to talk about these people, we can still build the same sort of spiritual therapeutic relationship, but maybe our skills look a little different. They're still empathic skills, but they look a little different. So now, instead of summarizing the content, we're really thinking about mirroring back what we see. That might be the emotions. At times when I'm working with clients, first thing I do is I try to be a mirror to them. So when they're looking at me and their brows grimace, I do the same thing back at them. When they're looking at me and they're smiling, I do the same thing back at them. So I actually mirror on my face what I am seeing in them, and that is a type of empathic skill. Then I might actually try in my mirroring to name. So when they're like, this seems like you're maybe confused, or seems like you're upset, or like this seems like you're happy. I was out with Ron, the spiritual care provider out in Baker City, one of the spiritual care providers out in Baker City, and the patient was kind of opening and shutting eyes like this, back and forth. And so I just started to do the same thing, and then I said, it seems like you're playing with me, and then she laughed, So these are ways to form the same type of relationship with people that have a lower level of cognition. Then we have the joining skills. Now, what a joining skill is where we start with mirroring maybe, and we start to get a sense of what the client could be feeling. And then we actually try to join them in that experiencing. So like if maybe we're getting from the client that it's a sense of fear, how can I really enter that fear with them so they can feel like they're joined in that fear? And this could move you towards action in the relationship. So it comes to mind a woman that I was working with who was afraid of the dark. And so as I joined her in experiencing it, and I could see that she was scared, and I could look around and kind of name things that I might be afraid of in the same situation. I noticed that it was dark in the room. So I was saying, it's dark in here. And I got a visceral reaction from her. She necessarily nodded, but she became kind of more agitated. And so I noticed that, and then I turned on the lights in the room. And when I did that, she actually decreased in her agitation. So these are ways in which you can use joining skills on an empathic level to really join with your client. And then we have things like silence. Silence can be a very empathic skill, where we just simply sit with, pace our breath at the same pace as the person that we're sitting with, to see if we can get a sense of what are the feelings in the room and really come into contact with those things. So oftentimes before I move to action, even when I'm working with this validation skill set, I start with these mirroring skills. I start with these empathic skills rather, where I'm really trying to join the client's frame of reference, right where they're at. So moving then from empathic skills into congruency skills. Congruency skills offer to the speaker the listener's frame of reference. I noticed there's a typo there, and I'll try to get that fixed. So where empathic skills have to do with the listener staying in the speaker's frame of reference, congruency skills have to do with the listener offering to the speaker their frame of reference. What's happening inside of me as I'm working with my client? And how can I become aware of those things? And then when should I be offering them? And how should I be offering them? This is really what the congruency skill set's all about. So voicing to the speaker what the listener is aware of, but what the speaker may not be aware of. If you've done any work with the Johari window, this could be helpful in the insight here. Johari windows, remember that four-boxed windows. And when you're looking at that, you have what the client is aware of and what I am aware of in one of those boxes. In another box, you have what the client is aware of, but I am not aware of. And then in another box below that one, we have what I'm aware of, but the client is unaware of. And then in that unknown box is what I'm unaware of and what the client is unaware of. So that kind of 4 boxes. When we're talking about congruency skills, we're dealing in that box where I have the awareness, but the client does not. And how can I be compassionate enough to offer my awareness to help build the client's awareness or of their experiencing in such a way that I am not creating too much threat? So congruency skills enable the speaker to trust his or her experience of the listener, of me. When he or she feels understood, he or she is understood. If he or she experiences the listener's irritation, the listener does not pretend it does not exist. So when I am irritated and I get a sense that the person that I'm working with understands my irritation, I don't pretend like that doesn't exist. I bring that into the room. We use that in the work that we're doing. And then the listener, in this way, the speaker learns he or she can trust their own experiencing. So they get from me a congruency, that when they experience of me, their experience of me, that they can trust, so that when they're picking up on real things, I allow those things into the relationship. But all this comes back to, don't lose this idea here, that we're really trying to voice that which is unaware to the client but is aware to me in such a way that the client starts to build new awareness. So just like with empathic skills, there are 2 basic processes. Here with congruency skills, there are also 2 basic processes. First, the becoming aware of your own feelings and thoughts about the person you are listening to. So as I become aware of it, am I frustrated by this person? Am I irritated by this person? Is my irritation about this person because they're not dealing with this one issue, or they're not taking my advice? So what is happening in me? What's bubbling up inside of me? And then how, the second part of this process is learning when and how to communicate that awareness to the client. One way that, and we'll talk about this here in a second, but one way that Roger's always talked about doing this with his client was what he would call his imagination skill set. So he would have these little kind of nibblings. He would see the client as superior, like a princess sitting up on a cloud. And he would kind of gauge how long he would have to use the empathic skills to have enough trust in the relationship that he can actually come to them and say, you know, I really get this sense that you're like a princess and you sit high up on the cloud and you like to dictate down to these little people below you what is right. And then to use that and build it into the relationship. But you need to understand that these congruency skill sets, when we use anything like this, when we start to build an awareness in our clients of that which they are unaware of, or they're denying or distorting, that can create a lot of threat in them. So these are more risky. This is kind of a riskier side of the relationship when I start to use my frame of reference and offer it now to the client. So from our charting then, when we start to think about some of these particular skills, these are skills like interpreting and reframing, where I listen to the story that the client is telling me, and I hear the way that they're making meaning out of it, and then I offer to them maybe an interpretation or a reframing of the meaning and see if they're able to work with that. Now once again, what we want to be careful with here is that we don't just deny their own feelings, but we offer it back, and we offer it in a non-possessive way. So we don't need them to agree with our interpretation or our reframing, but merely to process the alternative of what we're offering and see if they can continue to break into new awareness. So I guess I should go back and say, because the mistake that I see a lot of times with people that are practicing with congruency skills when they're using things like interpretation and reframing, it's almost like it becomes necessary for them to have the client agree with their reframing or their interpretation. And so they almost move themselves into a situation where they're arguing with the client rather than working with the client in an empathic or in a person-centered way. Influencing responders. These are things that one of the supervisors I had would talk about pushing at the door. When I become aware that this is something that's outside of their awareness, and I want them to invite them to process this. So how can I bring those things up in a way that really influences them to talk about these things, but does it once again in a non-possessive way. So if the client decides not to talk about these things, I am not, in a way, it's not necessary for me to have them talk about these things. So one example might be that I'm listening to a client and they're telling me about a whole lot of anger that they have. And then maybe several weeks ago in another session, they told me about the death of their father, and there were issues or themes of anger there. I'm wondering, if those two things might be connected. So I want to always balance, follow their process, but see if I can't influence them, like to bring up this issue of the father. This sounds a lot like when we were talking the other day, and you talked about your father's death and the feelings of anger you had around that. And so I just bring it up, and I try to influence them to talk about it. Now, once again, in a non-possessive way. So if the person denies that, or moves away from it, or creates too much threat, that I allow them to make that move. And once again, I trust their own process. I do believe that the client knows what's best. I can offer feedback. Now, what feedback is not so much, it's not advice giving, but a lot of times clients want to be kind of validated that what's happening, that we're seeing progression or growth in them. And so they'll come to us and kind of look for feedback. And so sometimes it comes as like advice seeking, like they want us to tell us that this is okay or that's okay. We want to avoid saying that that's okay. But at the same time, it's maybe important to pick upon a couple of the issues that we're seeing in the relationship, just to let them know that we're seeing movement and growth. Common way that I do this with people when I offer feedback, excuse me, is I'll kind of say, I am seeing positive movement here. I don't like to use that word positive. I am seeing just ways that you're growing. Now you're able to sit with your feelings of anger. And before, when I would bring up anger, you would move directly away from it. But now you're more willing to sit with that anger and to feel what it feels like and understand what it means for you. So those are ways that I offer feedback to clients. Self-disclosure. Now, self-disclosure is a commonly confused thing inside of the helping relationship.